after year, many Americans suffer from minor aches and pains of unknown origins. The old adage, an ounce of prevention is worth a pound of cure, is quite true. And it sums up what we can do to avoid those aches and pains. Well, it sounds simple. It is, if those aches and pains are discovered in time. Here to give us some insight on this most important subject is Dr. Matthew Schmid, who's a chiropractic physician of the Raleigh Chiropractic Center of Raleigh, North Carolina. And also joining me is Mr. John Smith, who's also a chiropractic physician of Highways Chiropractic Center in Raleigh. Tonight, we ask that you call us tonight at 683-2319 with any questions or comments that you may have for our guests. Once again, that's 683-2319. Our topic, your health. Just how important is it to you? Good evening, gentlemen, and welcome to Insight.
Thank you, Sandra.
I guess I'll start with you, Matt, by giving you an opportunity to give our viewers an idea of what the chiropractic profession entails.
Well, basically we see patients just as any other doctor would and examine them. Most of our patients come in to us for musculoskeletal type problems, which means aches and pains in their back and neck, headaches, leg pain, arm pain, automobile accidents. We see a great deal of these type of problems. The profession itself started way back in 1895 and has progressed a long way in the 90 years that we've been in it. But basically the patients come into us for back pain and lower back, I'd say, is 70% of our patient clientele.
How many of those patients actually come to see you for aches and pains other than those that they've encountered from, say, an automobile accident such as whiplash?
Well, a great deal. Many of our patients come to us with pain of an unknown origin. They'll come to us and say, Dr. Schmid, I don't know. I woke up this morning with back pain or neck pain, and I really don't know what I've done. And very often we have to uncover the patient. They're like a puzzle that we have to deal with. We have to find out what the root cause of their problem is. So it's not an easy task sometimes, and sometimes it is simple. It's a very obvious problem.
Okay, thank you. Once again, I'd like to remind our viewers that tonight's program is live, and we invite you to call in at 683-2319 with any questions or comments that you may have for our guests. Our topic tonight, your health. Just how important is it to you? With Dr. Matthew Schmid and Dr. John Smith, both of Raleigh, North Carolina. They're chiropractic physicians, and I'm quite sure that there's something that they can tell you that can help your aches and pains during your daily life. John, let me ask you this. In terms of some of the things that people do to injure themselves without realizing what it is that they're doing to themselves, how can they prevent such things such as minor backaches and things, in terms of their sitting and whatnot?
I think, Sandra, that there's a lot of postural type problems that come through in as much as proper sleeping habits, people that ignore certain postures at bed rest, which is 1/3 of that person's resting or activity period, in as much as how their spine is postured. I think also, too, that proper bending, lifting procedures, work-related injuries, which we there at Highwood see a lot of, in as much as how they bend their knees properly, keeping that particular object that they do lift close to them, and really trying not to twist and to mimic a sit-up type posture while they're bending. I think also, too, secretarial with the newer, being the generation that we're in the 1985s, we're finding a lot of video disc display terminals, and there are a lot of high-tech postural problems that we're seeing where at our practice, like Dr. Schmid's, we're seeing a lot of the newer secretarial type of problems where someone is constantly staring into a display terminal. That causes, as some of the later studies have shown us here quite recently, some of the cervical tension or the neck tension, which causes a lot of the postural type problems that we're now seeing in today's age. Again, I think it's a matter of prevention and finding out that you're quite suited to your job and that you have proper insight on how your spine should be handled, and so that not to cause muscular, ligamentous, and nerve problems, which so many people feel their aches and pains from.
For someone that may have experienced a traumatic experience during their early childhood life, and say, for example, they've gone on for years and years and years just having a pain in their side or a pain in their neck. If, for example, that person would come and indeed see a chiropractor, could that problem be cured?
Okay, well, first it has to be established through a very thorough examination that it is chiropractic in nature. For, like myself and Dr. Schmid, that we don't, just because someone walks into our office with a particular pain of their arm or of their leg or even of their spine, not necessarily is chiropractic in nature. And part of being a good chiropractic physician is determining the type of the problem, and in as much as laboratory testing, complete radiological procedures, and a thorough orthopedic and neurological examination will help better reveal that person's problem to us.
Okay. Dr. Schmid, let me ask you this question. In terms of treatment for a patient, once it's been established that your chiropractic treatment can indeed help them, how long would it take over a period of days in order to bring this person back up to an adjustment, a proper adjustment level?
Well, that entirely depends on the patient's nature of their injury. We see patients who are anywhere from a year old to 80 years old. And most of the average patients, I say, are from the age range of 25 to 40. The treatment period entirely depends on how long they've had the problem and the nature of the problem. A very severe disc problem in the lower back could take 3 to 6 months to treat. A very acute onset, say playing tennis, an injury to your lower back, and you come into the chiropractic physician within first 2 or 3 days, the injury is relatively simple to treat. A lot of times that I see patients in my office, though, that have not bothered to deal with the problem early on when they first feel a joint injury. They don't bother with early treatment. They'll wait till it goes away. That's a very dangerous thing. Waiting till the problem stops hurting, and then maybe the next time it flares up, dealing with it. Now, very often I'll see a patient who is hurt 3 or 4 times for weeks at a time before they ever get to my office.
Yeah.
And by that time, it takes a good amount of time to treat the problem.
An interjection I'd like to make in complimenting Dr. Schmid, that too many times, due to the lack of the knowledge of the chiropractic profession, we find individuals who enter our office who have exhausted all other health care means. And that's, unfortunately, we have to take on a condition that had warranted care months previously to the entrance.
Okay. Yeah. Let's go to our phone lines and see if we have a caller. Hello, Insight, you're on the air. Hello, Insight, you're on the air.
Yeah, I have a question for either of the doctors.
Okay.
Is there a way that a person could check their spine at home to see if it was straight without going into a clinic or anything?
I'll take that. Yeah, there are basic, simple checks that you might want to use for your children, but as a rule, it's much safer to go to a chiropractic physician to get it checked professionally. There's no reason not to. There are very simple procedures, though, to check for a patient's straightness of the spine. If you look at a patient in what we call the neutral position, with the patient standing up straight, arms down to their side, straight as they can with their head looking straight ahead, you can look at shoulder height. Very often you'll see with a curved spine a high shoulder on the right or left, a high ear. If you put your hands above their ears and check for the level, you'll see a patient with one ear higher than the other. That's a good indication that there's a curvature. But many people have curvatures, and it doesn't really have any clinical significance. Very often what we term a scoliosis, which is a curvature of the spine, is not important. 7 out of 10 people have some degree of curvature in their spine. In small children, though, it's very important, especially young girls who are much more predisposed to the scoliosis, to get them checked early. Have the chiropractic physician or someone who is trained in the spine to check this thing. Get it checked early.
Would it be indeed advisable to have people to try that on themselves at home?
Well, again, I gave some general checks. No, it's not advisable. It's much more appropriate to get a professional check it. Then if there is something to be done whereas the average layperson may miss something, if there is a problem, the chiropractor can catch it early. And
I think due to the nature and exactly what you're looking at as far as the curvature, what you're determining is the determination is not something that you do every other day. It's something that is a one-time thing and can be checked a year or years down the road from that initial treatment. And I think, too, with consideration to your question, I think that you should really realize that the hassle or the monetary gain is it's very much worth it because of just the one treatment, and to waste it would be foolish. I think that you should be checked, and you may not know what a spine looks like if you're being looked at.
Yeah, it's so much easier just to come in and do a quick 10-minute scan of the spine. I can look at a patient within 5 minutes, tell if they have a curvature and if it's something that's even significant. And Dr. Smith, we do that all the time. You know, we see patients who, through our literature that we have in our offices, the patients want to know if their children should be checked. And we do. We check children and adults all the time. Children are much more important because their spines are still forming. And you can catch an aggressive scoliosis or curvature of the spine early. You can treat it and hopefully, not always, but sometimes prevent the thing from advancing.
Is the caller still there?
Yes.
Are you presently suffering from any type of aches or pains in your spine area?
No, I'm not, but I was just worrying about my posture because I want to be a model, you know.
You want to be a model?
Yeah.
Okay.
Well, think straight and walk tall, and smile a lot.
Another question.
Okay.
Where he said that scoliosis is higher in girls. Why is that?
Well, there's different kinds of scoliosis, of course, but generally a scoliosis falls under the category of what we call idiopathic, not known. The cause is not known of the scoliosis, and that's a very common thing, 9 to 1 in girls.
Because of the age that you'll see. How old are you? May I ask the caller?
16.
Well, at that age and just a year or two before that, you may find that you may be taller than a lot of your male counterparts because of how women mature, say, faster than men, or girls before boys. And because of that growth development and because of the development, curvature, and posture or attitude of that spine, you'll find that curvature variance showing itself quicker.
Okay.
Yeah, it would be a good idea, especially if you're interested in modeling where you may wear backless things, even if it's not a pathological or something that's going to be a medical problem later on. Even if it's an appearance problem, you want to get it checked early, especially if you plan to be a model later on in life.
Okay. Thank you for calling Insight.
Thank you.
Once again, I'd like to remind our viewers that tonight's program is live, and you're invited to call in at 683-2319 with any questions or comments that you may have. Our topic this evening, your health. Just how important is it to you? Your aches and pains especially. We have here Dr. Matthew Schmid of the Raleigh Chiropractic Center of Raleigh, North Carolina, and Dr. John Smith, who's of the Highwoods Chiropractic Center, also in Raleigh, North Carolina. Give us a call at 683-2319. There may be something that you're not sure of in terms of spines, aches and pains, or any other disorders of the body. That, once again, is 683-2319. John, as we were talking about, the caller was talking about basic curvature of the spine. How harmful is scoliosis? Is it something that can be cured?
Cured is probably a bad word. A lot of times a successful treatment of scoliosis is to curb the advancement of it. Very often we've found through conservative means, a scoliosis can be treated successfully and reversed, actually. In certain cases, the scoliosis cannot be treated, and we need to take more drastic measures. And in that case, we'd refer them to an orthopedic surgeon or something of that nature after conservative means are exhausted. But it can be medically critical to get it checked early and to
one of the values of a scoliosis, if I may say, is catching it early, is finding that mothers that have young children, 8 years and on, to when upon school, you'll find in the growing numbers now in schools that they have nurses who are knowing what to look at in a child's spine to make sure that it is caught early. Mm-hmm. And the importance there is, like Dr. Schmid had mentioned, the advancement, to slow that advancement, and through conservative chiropractic care, that can be established. Depending upon the degree at that degree seen or monitored at that time. It's important to note that not all spines are alike, and the degrees in scoliosis is a general term for a curved spine laterally or side to side away from its normal position. And not every scoliosis or scoliotic spine is alike. That's why it is important for mothers that are concerned is to get them looked at, just to make sure.
How much can other neurological problems how much can they be attributed to problems of the spine, disorders of the spine?
Well, a great many. Now, when you say neurological, that's a broad term. Neurological involves anything from the brain to the spinal cord and the spinal nerve roots. We treat conditions that irritate the spinal nerve roots of the, probably from the neck down. Now, we see quite a few patients with headaches and so on. But as far as central nervous system, the brain itself and the spinal cord, we don't treat many conditions like that. I'm talking about things like brain tumors and things like that. We deal mostly with aches and pains of the spine. As far as what we call radiculopathies, which are advanced cases of nerve root irritation where the patient will experience pain in their arms and legs and so on, we treat a great many of those. I'd say 4 or 5 out of 10 people that I treat have an advanced case of nerve root irritation where the pain is going into their arms or hands, numbness and tingling in the hands or feet or legs. And we, of course, again, like Dr. Smith touched on, we examine them thoroughly, and if it's a problem that a chiropractor can help, we'll go ahead and treat that.
Can there be any negative side effects resulting from chiropractic treatment?
I think, as with any profession, the side effects depend upon the closeness of a thorough examination and the screening of that particular patient. I think with a thorough screening and an adequate treatment regimen, as well as an understood treatment regimen and conservative chiropractic care in relationship to that patient's needs, I don't think there are any side effects. Again, losing those factors, I think, like anything that you will encounter side effects.
Okay.
Well, yeah, he's exactly right. The side effects, I assume you're speaking of negative side effects, can be encountered, but very, very rarely, and much more rarely than people ever think. One of the things we encounter all the time is people coming into us saying, well, I've heard that a chiropractor will break my neck or break my back. That's absolutely ridiculous. There's no feasible way we can do that, and that's one of the things we battle with every day. I think the best example of that is malpractice claims are almost negligible in chiropractic. We don't hurt people. If we did, our malpractice insurance would be astronomical. We don't hurt people, and it's an interesting thing to see the patients coming into our office, and they are worried, and that's a valid thing, and we do try to calm them. And, well, you were a patient of mine, Sandra, and I think you were a little bit apprehensive when you first came to me. You didn't know what to expect, and we see that all the time, and we try to walk them through each procedure, and that's the only way to do it.
Now, most people that will go to a regular medical physician would probably be prescribed certain drugs to help aid their pains. Does the chiropractic profession do that?
No, we're the largest non-drug healing profession in the world. We pride ourselves in treating patients without drugs or surgery. That's the beauty of what we do. It's a natural healing method.
We like to think that most conditions, not all, are through a cause and effect relationship, in that when there is a problem, if you have numbness radiating into one of your arms, that it's not necessarily the arm pain that is the concern. I joke with some of my patients and mention that I'm not a walking aspirin. I just don't treat your symptoms. I really like to try to look and see what's causing those symptoms, see what is the root of that problem. I don't discount drugs in the office, and certainly feel the need for them on certain occasions and when they arise for certain conditions. However, there are a lot of conditions that are abused through drug therapy. I can give you one instance of where a patient of mine, his entrance complaints to my office were low back pain and severe abdominal cramping. And upon examination, there was severe nerve root damage to in his lower spine. And we found through a private conversation with his wife that he was taking a bottle of aspirin a day for that, and which, of course, ate away at the stomach lining, which caused his stomach problem. So in treating one problem helps another, and we don't like to think that just because you take a particular substance that cures that particular problem.
I think it's important to touch again that we're not against drugs by any means. We are against the abuse of drugs, and we see patients 90% of the time, well, maybe not 90%, but a great deal of the time, who've been to their medical doctor, have been to their orthopedist, referred to their orthopedist, and they're given pain pills and muscle relaxants for back pain and so on. And very often those are covering the symptoms rather than treating the cause of the problem. That's the only problem I have with drugs. Very often it's important for the patient to be able to control their pain while we treat them. So a lot of times patients are on a pain-killing or muscle relaxing drug while I treat them, and that's okay.
And I think that touches on some of the philosophy that chiropractic tries to maintain, in as much as listening to your body. The pain is there for a reason. If you are experiencing severe low back pain, and perhaps in an unfortunate situation where you're given too much of a muscle relaxer to quiet that pain, may make you feel as a pseudo or a false feeling of your low back, and perhaps you may do more and hurt yourself.
Okay, let's go to our phone lines and see if we have a caller. Hello, Insight, you on the air?
Yes, this is Bird. Hi, Sandra.
Hi.
I just wanted to ask the physician one question. Is it normal for someone with slumped shoulders to have a pain, or not really a pain, but like pressure between the shoulder blades?
I don't think, again, as we were discussing with the scoliosis, I think that to have a curvature, your body does adapt, and you'll find that through many mechanisms internally, your body will adapt to quiet that pain. As in scoliosis, and treating many patients with that, many of them do not experience pain. It depends on your particular condition, and through a thorough examination can that problem really only be determined.
Okay, where's your office located?
My office is on North Boulevard on Highway 1 in Raleigh, North Carolina.
Okay, what about your colleague?
I'm on Six Forks Road at the Raleigh Chiropractic Center.
Okay, why are you guys so far away?
There's a very good contingent of fine doctors of chiropractic in Durham. You are a lucky city. There are many good doctors here.
Okay, appreciate it. Thank you.
Thank you for calling. Once again, I'd like to remind our viewers that tonight's program is live, and we invite you to call in at 683-2319 with any questions or comments that you may have. Tonight's topic, your health. Just how important is it to you, especially your aches and pains? I have here with me tonight as my guests Dr. Matthew Schmid and Dr. John Smith, both are chiropractic physicians of Raleigh, North Carolina. Dr. Schmid of the Raleigh Chiropractic Center and Dr. Smith of the Highwoods Chiropractic Center. You're invited to call in at 683-2319 with any questions or comments. Again, our topic, your health. Just how important is it to you? I'd like to ask this one question. It has sort of been a, I guess you might call a cliche in the past for chiropractors to be called quacks.
Unfortunately, years ago, there has been an estimation through a lack of research and from chiropractors of old, perhaps taking on maybe more than they should. Chiropractic is not a cure-all, and unfortunately, because of the excitement and the building of the profession, it has been sometimes distorted as such. Because of the modern advances, the new chiropractic research that has been factual on paper and documented, that there has been a despondence of that. We're really losing that particular coverall. We accept what we can treat, and it should be referred if it can't be.
I think you'll find the average doctor of chiropractic now realizes that he has a scope of practice, and we, like I said, we treat mostly musculoskeletal problems, aches and pains. The old-time chiropractic physicians got in trouble, and by talking about treating systemic diseases, you know, anything from cancer on up. But we, of course, that hasn't been really the philosophy of the profession for 70 years. We know now what our scope of practice is, and we don't get into the trouble now. Of course, we've had problems because people remember those outlandish claims. You know, there may be 1 out of 1,000 that would say something like that. And we get into trouble for that even now, and I think that we're still suffering because of that.
I think in comparison, I think that you'll find through most modern medical research that when they look back in the past that they regret a lot of the drugs that have been on the market through their side effects and the harmful effects that they've done to children. And those drugs have been pulled from the market. I think you'll find through a basic medical research that the professions have advanced, and that a lot of those negative feelings that a lot of people carry are only can be contended with through time.
Yeah, it's exciting to be in the profession right now because it's growing by leaps and bounds. The acceptance of it is much, much better than it was, and only because we're grounding ourselves in scientific information. We're getting the facts down, the basics down. Even the medical doctors now are learning to manipulate, not all of them, of course, but some of them. We know now manipulation is a valid entity. We know it has its place in the healthcare profession, and it's only a matter of time to dispel the old myths.
Now, you say manipulation. For some of our viewers that may not fully understand what that
Right.
means, could you clarify that?
Sure, I will. Many of our chiropractic problems that we see in our office are joint-related in nature. They're problems of the spine and the extremities, which means arms, legs, knees, elbows, things like that. The joints don't function correctly. They just plain don't move like they should. There's a phrase that movement is life, motion is life. That is absolutely true. We are trained to examine the spine for movement, and when we find a lack of movement, we simply treat that area. Now, the ramifications of that lack of movement are tremendous. They can cause tremendous pain and compensations within the spine.
Let's go into more specifics. Specifics when you speak of movement of the spine. I believe you brought something with you to
Yeah, I did.
give us a little.
It's a little visual demonstration, very simplistic, but the thing I have in my hand represents the spine and the normal movement within the spine. We know that the spine is composed of vertebrae, one on top of another, and they have joints between each of the vertebrae, and there are 24 movable segments in the spine. We know that they move in 6 directions between each of these vertebrae. They move in forward bending, they move in backward bending, they side bend at each level, and they rotate at each level. So we can examine the spine for that normal movement, what we know should be normally in there.
I think it's also important to mention to the viewers that there are spinal nerve roots that exit each of these 24 movable vertebrae.
Right, between these vertebrae, right in between, and they're actually very close to the vertebra between each of these levels. Now, when you say when we talk about manipulation, we're finding the area in the spine that does not move. We have the red beads here to demonstrate that.
Okay.
And
before we go on, let's go to our phone line, and we'll come back to that.
Sure.
Hello, Insight, you on the air?
Hello.
Yes.
I have a question for you.
Okay.
I've noticed women and men wearing shoulder pads. Shoulder bags, you know.
Uh-huh.
And I've noticed that the body is sort of slanted over toward the side that they're carrying this shoulder bag on.
Uh-huh.
Are there any distortions of the spinal cord due to prolonged carrying of these bags?
I think, if I may, that you'll find that, as I mentioned before, the spine, as all many other parts of the body are, in as much as a defensive mechanism inherently within the body, that maintains that we're an adaptive organism, and that spine, if the body considers that as being part of or of the body, it will adapt to it. It will take measures to your muscles will strengthen, and that will act as a constant weight. I know many times jokingly in our office that I will casually pick up the handbag of a patient and make jokes that, what do you have, 2 bricks in there? And let's empty it out, and let's get the pressure off of that area. Your body will adapt to that. Your muscles will get stronger on one side. As Martina Navratilova, who's playing in the U.S. Open now, you'll notice on her right arm, it's much more built up. That musculature has adapted to that movement, to the carrying and swinging of that racket, whereas her other side is much less.
Sure.
Okay. Is the caller still there?
Thank you very much.
Okay. Thank you for calling Insight. Let's go back to the
Okay.
explanation there.
Right. The manipulation, the word that I use there is to describe the actual recreation of movement in a joint that we find frozen up. That's what we would do for a living. We examine the joints of the spine and extremities and look for movement. And if we find an area that's not moving, we simply rehabilitate that joint. And when we use these red beads as the ones that don't move, this is a good illustration of how the spine compensates, like Dr. Smith was talking about. The body will adapt eventually. So if you have an area in your spine that's locked up like these red ones, you'll move above and below that area too much. You're going to get what we call hypermobility, or increased movement above and below that fixated or locked up area. Now the nerve roots that come out of this level, of course, are going to be stretched, because you don't just stand here. You move. That's what we do in life. We move. And these nerve roots are going to become very irritated. Now, again, the ramifications of that are very great. The spinal nerve roots, when they're irritated, can cause numbness, tingling, pain, burning. We see a great deal of these things in our office.
Now, also in between those vertebrae,
Right.
okay, if you will, are nerves. Now,
That's correct.
pinched nerves.
Okay, that's it. Go ahead.
How much pain does that cause? I know it causes a great deal of pain, but in terms of loosening the nerve that has been pinched there.
Well, a pinched nerve is a term that has been brought up over the years. It's a lot like the term slip disc. It's a misused term. It's a very easy one to comprehend for the patient. And a lot of times I get them filling out their forms saying I have a pinched nerve in my neck. You can't actually pinch a nerve. But again, if you have this concept down, you can very greatly irritate a nerve by stretching it. Stretching nerve is just as bad as pinching it.
Pinch nerve, I think too many times has been used as a swelling around a particular nerve root and not so much a direct pressure on that root. Many times the contiguous structures of the spine, your musculature, your ligamentous structures, will, and as well as what they call a neurovascular bundle, which is all of those. It's neuroligamentous. It's basically what it is a lot of the structure around the spine can cause that irritation or that swelling of that particular nerve root, and thereby cause that pressure.
And the therapeutic goal of a doctor of chiropractic is to, again, find the area that's not moving properly and simply rehabilitate the spine so that you have the 6 directions of movement. And that's what we're looking for in the spine, is normal, healthy movement, and the pain takes care of itself.
Thereby, going back to what we said, cause and effect, getting to the root of the problem, finding out why is that arm numb, why is that patient experiencing headaches, or that sciatic pain, that pain down the back of or front of your leg, and freeing those fixations, if you will, of the spine, and coordinating the proper movement, the biomechanics, if you will, of that spine, will help release that pressure and help better maintain the overall health of that individual.
Okay. Thanks. That was a great demonstration. Once again, I'd like to remind our viewers that tonight's program is live, and we invite you to call in at 683-2319 with any questions or comments that you may have. Our topic tonight, your health, just how important is it to you? We're specifically discussing your aches and pains with Dr. Matthew Schmid, who's a chiropractic physician of the Raleigh Chiropractic Center, and also Dr. John Smith, who's a chiropractic physician of the Highwoods Chiropractic Center, both of Raleigh, North Carolina. Give us a call at 683-2319 with any questions or comments that you may have concerning your back aches, your neck aches, your ankle aches, for that matter, at 683-2319. We're going to go to our phone lines and see if we have a caller. Hello, Insight, you're on the air. Insight, you're on the air. Okay, I think we're going to put that caller on hold right quick. Going back to basic pains, okay? A lot of times people do a lot of bending when they pick up boxes and things of that nature. How much damage does that, over a period of time, how much damage does that actually do?
Well, we greatly stress proper lifting habits in our office. Very often, patients will come in after an on-the-job injury. They're lifting something improperly, and I think that's one of the basic things that we deal with in our office.
Okay, let's go to our phone line. Hello, Insight, you on the air?
Yes, when you have a lower back problem and your legs, both of your legs is hurt, they're numb, and you feel as though you have a stabbing pain in your back and you can't straighten up sometimes. What could cause that?
I suggest that you get to a chiropractor right away and let him evaluate you to give a proper response to that. It's very difficult to let you know what could cause that when we can't see that particular condition.
To be more specific, though, a great deal of things can cause it. That's why the examination is so important. You have to differentially diagnose a disc problem from a sacroiliac problem, from a plain old muscle strain, and from something more serious than that. That's the value of what we do as far as examining. We need to differentially diagnose it. We can't tell over the phone.
That's why we feel that it's important that you get somebody to adequately look at you and the ramifications of your problem.
Right.
Okay. Are you currently suffering from the pain that you just described?
Yes, I am, and I've had surgery once before, and I've had, I think it's this chemionucleosis once before, and I'm still being treated at different clinics for it, you know.
We see a great deal of post-surgical low back cases. Very often the surgery is the only answer at one point in your treatment, but afterward, very often 2 or 3 years later. How long has it been since your last surgery?
October will be a year. October 18th will be a year.
That's really common. We see a great deal of, again, post-surgical backs that very often we can't help symptomatically. We can't bring your old disc back. It sounds like you've had a pain surgery, and that's pretty common. But again, we have to evaluate you. Maybe we can help you, maybe we can't. Again, we can't make you into an 18-year-old again. We can't bring your disc back.
But there could be some adjustments or some things done that would help.
Sure, we see a lot of those kind of patients, and a great deal. Very often we have to agree at a logical therapeutic goal. Maybe I can't get you 100% well, but maybe I can get you 80% well and you don't hurt, and that's very important. To some people, that's a great deal.
Okay. Thank you for calling Insight.
Okay, thank you much.
And hello, Insight, you on the air.
Yes, I have a question for Dr. Smith.
Okay.
Dr. Smith, are you familiar with ibuprofen
Yes, I am.
and Flexeril?
Yes, I am.
Okay, I'm a mail carrier in Durham, and from time to time I have problems. I guess you know we carry the bags.
Right.
And they prescribed the ibuprofen and the Flexeril, and it's not really seeming to. I have a stretching type of low back pain from walking, and I was wondering if it will get better, or if it's due to the cause of the job I have, or.
Well, of course, if you are actually carrying the bag, it's certainly not going to help it by carrying it, but the Flexeril and the ibuprofen are attempting to alleviate the muscle spasm and the inflammation you have in the joints and in the nerve roots. To say that it's going to go away is awfully hard to say. It may be a simple thing, but if they prescribe Flexeril already, chances are it's a little more serious than just a simple strain, and you probably would want to get it looked at eventually, and probably the sooner the better, because these things tend to become more frequent and more severe.
Yeah, well, I've been put on bed rest for 7 days, so I'm not seeming to get any better, so...
Well, again, I think what Dr. Schmid is suggesting is that again, to the cause and effect, if you're, obviously, that is not being handled through, from what it appears of what you have said, through the cause and only to the effect of your problem at this time. I think that occupationally that a close look is needed.
Would it be imperative to proceed with an X-ray to determine the extent of damage if there has been any done?
Your X-ray, if it is a routine X-ray at a chiropractic physician's office, will not show nerve damage. It will only show the bony or the thicker parts of your body. And a lot of times an accurate diagnosis cannot be maintained from just a simple X-ray.
Right.
To answer your question, though, your body does not hurt because of a lack of Flexeril in it. You're hurting because there is obviously some sort of a structural problem, ruling out, of course, fractures and tumors and dislocations. Probably it's a structural problem, and you need to have it looked at. Yeah, I don't think you're going to respond if you haven't yet, you probably will not respond to the Flexeril. I can't say for sure, but that's my clinical experience.
Could there be a problem that could reoccur due to an accident that happened about 10 years ago that left me with thoracic problems?
Yeah, that's really common. We see a lot of patients who have had the pain 5-10 years ago and haven't had any problems since then, and it develops kind of on the sly, and then there you are with the problem. But yeah, I definitely have it looked at. That sounds serious.
So I would need to see the chiropractic instead of orthopedic surgeon, or which is the...
Well, it depends through the means of diagnosis that's followed. Once diagnosed, and the appropriate physician, if you will, should be called. It's simple to maintain that a general problem by yourself, self-diagnosis, if you will, just can't be handled. You have to go through the inside means to get to someone that, if they cannot determine your problem, that will accurately refer you to someone who can.
Who put you on the Flexeril and the ibuprofen?
Duke Hospital.
Okay.
Dr. Bevan, I don't know what his name is over there.
Okay. What I would do if I were you and you were my patient, I would examine you as a chiropractic physician, and if I couldn't help you, I'd refer you to an orthopedist or a neurologist.
Well, I think they had questions. They'll make an appointment this week. I have not seen a specialist yet. This was through the emergency room.
I see. Well, again, I would go to a chiropractic physician in this area, and if he can't help you, he'll tell you.
Okay, thank you very much.
You're welcome.
Thank you for calling Insight. Once again, I'd like to remind our viewers that tonight's program is live, and we invite you to call in at 683-2319. Our topic of discussion this evening, your health. Just how important is it to you? We're specifically focusing on your aches and pains, surfacing around your spine, your back, your neck, your elbows, you name it. I have Dr. Matthew Schmid here with me, who's a chiropractic physician of the Raleigh Chiropractic Center, and also Dr. John Smith, who's a chiropractic physician from Highwoods Chiropractic Center, also of Raleigh, North Carolina. Give us a call at 683-2319. We'd like to hear from you. Maybe there's some suggestions or something that these two gentlemen can give you that can help you avoid some of the aches and pains that you've been suffering. Once again, that's 683-2319. Let's go to our phone lines and see if we have another caller. Hello, Insight, you on the air.
Hi, I got a problem that I'm having. I used to run a lot. I'm very athletically inclined, but I'm having problems with my right leg. I go to raise it when I'm running, and it seems like my toe wants to drag the ground, as though I'm losing feeling in it. I can't raise it up. Can you tell me exactly what might be happening? No, baby.
I would, if I may, I would first make sure that the preliminaries are there in as adequate running shoes, and to make sure that you've been properly guided by someone that specializes in that area to make sure that you're getting adequate arch support and a lot of the things that you can do yourself through coordinated...
When your foot drags the ground, does it feel like it's because you don't have the control over it, or because your leg is weak, or because it hurts?
It's like I don't have control over it. The leg doesn't hurt, but it has a tingling feel in it. And it happens even when I'm walking. You know, it's something that I try. You know, I really don't want to admit this being a problem, but it is. Wow. And I try to correct it by keeping my mind on it, trying to walk straight sometimes, but yet it will still leave me with a dragging motion of the right leg.
I understand, and it sounds like a problem that is bothering you enough to call in here. I think that chances are you need to have it looked at, and I would definitely make an appointment with a doctor, whether it's a doctor of chiropractic or a medical doctor. Someone will be adequately trained to check it out. If you have the tingling feeling, the pins and needles feeling, chances are you need to have it looked at and do it soon.
All right.
Thank you for calling. Is that a common problem with many athletes?
I think you'll find that a lot of athletes are weekend athletes, unfortunately. One week they're white-collar businessmen, and then over the weekend they're Frank Shorter. And they'll go out on the spur of the moment, not properly warming up, warming down, the lack of proper running, walking, boating gear, if you will, and there is an adequate preparation. And the body needs to be reminded that it's not sitting in a business chair all day long, that it's out pounding the pavement. Mm-hmm. And injuries do occur so frequently in that regard.
With the injury he's having, though, as a runner, that's not a very, very common one with runners. We see a lot of ankle problems, knee problems, lower back pain. The numbness sounds maybe like something different, and he needs to at least have it examined. And especially the fact that he feels like he's losing a little control. Mm-hmm. You never know, it may have neurological implications. Have it checked.
I think one of the things in general that runners and athletes can look at, if they are consistent with their activity, if they have a proper guideline to the course of that activity, and they are experiencing a consistent, persistent muscle pain, nerve tingling, a non-associated pressure that they were not accustomed to, and as much as a pain in the toe or a dragging of the foot, that it should be looked at. That problems, because of the body's adaptive ways, it will tend to linger.
How many patients do you have actually just come to your office without being referred?
We have a fair amount of patients, probably 80%, that come into our office looking for help. People that not necessarily that it's the last straw, but people that are concerned enough about their health, the education that is at hand now. People are finding that it's not necessary just to pop a pill to get relief. They're finding that the body is a self-contained mechanism and it needs to work with itself. I find it exciting in chiropractic because I just use my hands therapy and manipulation, as Dr. Schmid had said.
Right.
And the
Well, we
rehabilitation of that health.
both Dr. Smith and I practice very similarly. We use, as all chiropractors do, we use our hands as a primary treatment.
For that manipulation of that particular area that's involved.
Right. And we also use some physical therapy modalities, which mean electric muscle stimulation. We'll use ultrasound therapeutically. We'll use heat and ice and traction and things like that to aid what we do. But the main thing that we do in our office is check the spine for immobilities and to remove them, period. Rehabilitate the spine.
I think you'll find chiropractors in 1985, as both of our offices can maintain a complete laboratory facility to differential, as a differential diagnosis, to make sure that we are working on the problem that we're supposed to be working on. Complete X-ray equipment, and with the most modern therapy equipment known to the profession.
Do you see many children in terms of little minor spine injuries?
I don't know about Dr. Schmid, but my practice maintains probably about 3 to 9, 4 to 10% of children. Most, again, as Dr. Schmid had mentioned, that it's usually about 25 to 40 years old.
That comes with patient education. Now, if you train your adult patient that these little injuries to the spine can cause problems 5 years down the line, they'll say, little Susie just fell down the stairs the other day, should I bring her in? And I'll say, sure, bring her in, let me check her, I'll look her over. If there's nothing wrong with her, I'll send her home with you, and don't worry about it. If it's a small problem that has just arrived in the spine, we'll treat it, and it's gone. So she doesn't have to worry about it 5 years down the line.
And I think, too, in speaking of children and going as young as infants at the toddler age, that it's important to be aware of the spine and that what the body is ready for. If a child was, for instance, at an early age of 12 months to be somehow walking, that it's fairly unusual. Many children are put in walkers that they will sit in and then stand up on, where that not necessarily should be the case, because that is the forming years of that young infant's.
How would a parent know to consult a chiropractor if a child constantly says, "Mommy, Mommy, I have a pain," but doesn't really actually act as if it really has a pain?
Very often children won't tell you anything. They'll if they injure their neck, they'll turn their neck this way, and you'll see them turning this way. That's one of the problems we have with children, is that they don't tell you when they hurt. And you need to really examine them, make sure that you understand the child, and if they are complaining of a problem, chances are it's probably there.
I think it's real important. I think it's real important to maintain the attitude of the child, and as hearing disorders are so common in young children, that you test that person, that you look at them and make sure that they're moving, and in those motions that Dr. Schmid had mentioned, and that they're doing that adequately.
Let's go to our phone lines and take a call. Hello, Insight, you on the air?
Yes, I've been diagnosed as having a herniated disc, and an operation has been suggested. If I don't have this operation, what will be some of the consequences?
Well, if it is a true herniated disc and they've scheduled you for surgery, the consequences of not having it are the fact that you're going to hurt, and the chances are that the thing is only going to get worse. If it's a true herniated disc, there aren't a lot of options here. The only thing I can suggest is that very often a disc can be swollen or irritated, and it can respond to conservative means. I'm not saying that's the case in your particular instance, but I see patients who have been diagnosed as having a herniated disc, and it's not as complicated as that. I'm not trying to suggest anything dangerous like don't have the surgery, but I'm saying you may want to seek a second or a third opinion.
Thank you.
Thank you for calling. For those people that don't seek second opinions on a lot of the...
Well, I think there was a statistical research done in 1979, and the reference is not at hand, but you'll find that many of the low back surgeries that are performed up until that date, approximately 500,000 a year, almost 50% of those cases stayed the same with no significant improvement, and some of which did get worse. So depending upon that physician or that surgeon who is consulting you for that surgery, that should be made clear to you that it is not always it's not always understood that there is going to be complete relief in that particular case. Many people that walk into surgery feel that their problem is solved, and I think through correspondence and adequate dialogue with that surgeon, that should be understood.
We're not suggesting that surgery is not the answer. In some cases, I know Dr. Smith and myself, we refer patients all the time for surgery because there's no other answer. We exhaust all conservative means, and there's no other way around it, and the patient needs to have the surgery. And that's fine, and that's the way to go.
That does. I like to think that chiropractic first, surgery last. If you can be handled or corrected through conservative means, I think that's the path. Many times we have patients that walk into our office with conditions like herniated low back discs that have been or are so severe that we refer them right to the hospital.
Without taking films or anything. Yeah.
Okay. Once again, I'd like to remind our viewers that tonight's program is live. We have a few more minutes on our live set this evening. Our topic of discussion, your health. Just how important is it to you? We're specifically focusing on your aches and pains, lower back, upper back, neck, knee, elbow, arm. But give us a call at 683-2319. I have with me Dr. Matthew Schmid, who's a chiropractic physician of the Raleigh Chiropractic Center, and also Dr. John Smith, who's a chiropractic physician of Highwoods Chiropractic Center, both of Raleigh, North Carolina. Give us a call with any questions or comments that you may have during our last few minutes of the show. That's 683-2319. Once again, 683-2319. What would you, either of you, suggest to younger people that get out here and do what you might call breakdancing?
Well, breakdancing injuries have come into their own. They're very common now because it's so popular. Again, you can injure yourself in various ways with a breakdancing type thing. Like any sports injury, very often the insult is to the joints of the spine. It can be, like you say, elbows or knees or spine. It's the thing to do in that case is just examine the patient. If they're having pain in their elbow, you of course examine their elbow.
I think that too that breakdancing is fun as it is for the new generation. It can be fairly dangerous. The spine too many times is put on the head instead of the feet.
Okay, let's take one more call. Hello, Insight, you on the air.
Yes, I have a quick question there for one of you gentlemen there at hand. I'm wondering what would be the distinguishing marks between what is just normal everyday aches and pains of the back and what causes, what is something for real concern, you know? What would be your distinguishing guideline or a good rule of thumb to use, you know? I'm sure everybody incurs a certain amount of discomfort in their back from time to time, but sometimes persistent pain, or what would you go, a day, 3 days, a week, you know, what would be of ample concern before you start looking into getting?
That's a good question. I hear that a lot in my office, and the rule of thumb that I use is if the pain is of a very, very acute nature and you're laying in bed and you can't move, which we see a lot of, chances are you need to go to see somebody right then. If it's a mild ache or pain and it's something that you strained your back, perhaps try to start the lawnmower for the first time that year, and we see a lot of those, or raking
shoveling snow.
Shoveling snow, sure. The muscle aches and pains usually will go away within 2 to 3 days. And that's the rule of thumb I use with my patients. If it doesn't hurt for more than 2 or 3 days with good night's rest and proper care, chances are you need to see somebody.
Okay.
Just a little quick question before you leave.
Okay.
I mean, what pains would be the most concern? I mean, your lower back pain or the, you know, the area located close to your shoulder blades? So
I think that's asking a question like if you had a problem with your heart, lungs, or liver. It's just as important. If your neck is, if you're getting problems with your neck that maybe is causing pressure on the nerves that are going down your arm, it's no different than a low back problem with pain going down your legs. It's of equal concern and should be dealt with accordingly.
Okay, great.
Thank you for calling Insight.
Thank you.
Dr. Smith, Dr. Schmid, thank you very much for joining me tonight.
Thank you for
very
inviting us.
much.
And I'm quite sure our viewers have thoroughly enjoyed this insight on chiropractic treatment, and you might get your doors knocked down before long. And once again, I thank you, our viewers, for joining us this evening, our topic having been your health. Just how important is it to you? Specifically focusing on your minor aches and pains. I'm Sandra Staten, and once again, I ask that you write me if you have any questions or comments about any of the programming that's done here on Insight at P.O. Box 30002, Durham, North Carolina 27701. Once again, that's Insight, Post Office Box 30002, Durham, North Carolina 27701. We won't be with you next week. We're going to take a break for a week, but we will be back on the 17th to bring to you some information about university security. Just how secure are the college students on our campuses? Once again, remember, as always, ideas without action are like dreams without meaning. I'm Sandra Staten. Thank you for joining me. Have a good evening.
Thank you, Sandra.
Thank you.